The number of new COVID-19 cases each day is beginning to slow in the United States. Still, there are now close to 2 million confirmed coronavirus cases worldwide, and the death toll now stands at more than 125,000. Joining us right now with the details on how one of the largest healthcare companies in the country is helping this public crisis is Dave Dorman. He is the chairman of the board at CVS. He's also former chairman and CEO at AT&T. And Dave, thank you for joining us today. It's good to see you.
My pleasure.
Let's talk about CVS right now and what you're seeing, because you guys really are on the front lines. Pharmacies, of course, are essential businesses. You are there and you're staffed and you're open every day. What kind of traffic are you seeing? What kind of demand are you seeing, both in terms of the front of the store and of course, then with the pharmacies in the back?
Well, I think if you look at March, the first part of March, with the amount of people coming to the store, what I describe as panic buying, all manner of things, with the shelter-in-place order, traffic slowed down. It's still steady, but we have, as you know, 200,000 frontline employees that include 40,000 pharmacists, doctors, and nurses, and the rest are store employees who are there every day. We have another 100,000 management and staff employees, 70,000 a day, which are dialing into or connecting through our VPN. So for us, it's all hands on deck. Testing has become a really important part of what we're doing. We have great familiarity with the Abbott Labs platforms, the new one for COVID. We're active in 3 states in a private public partnership with those states: Georgia, Massachusetts, and Rhode Island. Over 3,000 tests a day are coming through CVS manned centers. We have a number of other states that we're in discussion with, too, that'll be coming soon. So the testing activity is really important. I think a couple of things that have come out of this, telehealth has gotten a lot more attention and a lot more activity. We're seeing a big increase in that utilization. Again, with shelter in place, people may be more comfortable talking to the doctor, through an iPad and describing their symptoms and thinking about what they need to do. Should they be tested based on their symptoms or not, or have they been positively identified, what they should do to monitor their condition. We see that enduring, past the coronavirus. We think telehealth will get a boost from this and continue. Same thing with home delivery. We have a CVS store, the 10,000 of them. There's a CVS within 3 miles of 70% of the U.S. population. So delivering directly from the store is a real advantage for us. And we're seeing that spike. We're approaching a million new home deliveries a week from CVS stores, and we see that continuing as well. I would throw out there, Becky, that one of the things we haven't heard a lot of discussions about, at least in the public domain, is let's just look at the facts as we know them today. A lot of work being done to find antivirals that will attack this virus, once it's had an onset and an infection, and how do you trap it, similar to what Tamiflu does with influenza. Number one, in belief that there are a number of highly competent pharmaceutical companies and researchers, looking for the right one. But an antiviral will happen. Similarly with vaccines, I don't know, it's probably close to a dozen vaccine efforts underway, and again, betting on the science, you'd believe we get a vaccine. Once we get it, how do those antivirals get distributed, and how do those vaccinations take place? Are we talking about needing to vaccinate 200 million people? I know there are 330 plus million people, but we can't even get more than 125 million to vote for president. So we have to figure out how those vaccinations are going to be done, because I have great faith we will get a vaccine. It's just a question. And we're thinking about that. Our CEO, Larry Merlo, has brought this up a while ago, because we give vaccines for flu and other things, shingles and the like in our stores today. This is going to be a big effort. If you think about how slow it's been to totally mobilize on testing, and now it appears that we are, as a country, mobilized on testing, we're going to have a similar but even bigger effort on vaccination.
Hey, Dave, that's a lot to kind of go through, but let's just start with the testing you guys are doing, because obviously we are getting better at testing. We have more that's coming out, but I'd argue we are not ready in terms of being able to reopen the economy just based on the amount of testing that's out there right now. How quickly can this ramp up? I know you guys are doing a lot of tests, about 3,000 a day at your locations. Why Georgia? Why Rhode Island? Why Massachusetts? And I guess I ask because I'd love to see it here in New Jersey. Yeah,
well, for us, we have communities that we serve, or we have Aetna members. Georgia, let's take that as an example. We have about 9,000 CVS colleagues in Georgia, including about 1,000 pharmacists. We have 335 stores, about 1 million insured. So it's a community that we have a lot of involvement in. So we're trying to focus our efforts where we have the resources for the testing, the nurse practitioners that can go man these test sites, because they're not at CVS stores. They're, in the case of Georgia, it's in a parking lot at Georgia Tech, which is a state school, state property, and proved to be a good location. It's working out great. So it's really driven by our community involvement. Obviously, Rhode Island is our headquarters state. We're the largest employer in Rhode Island, I believe. And Massachusetts, next door, we have a significant number of our employees, and that's where the company actually was founded.
When do you think that we will be able to reopen for business? I mean, we're hearing now that some states at least might be able to do it before the beginning of May. But I guess that very much depends on where you are, what the situation is in your state. And it's a little harder to see from a place like this where it's been hit so hard.
You're exactly right. I mean, New York is a totally different situation, both in terms of density and how New York operates from a mass transit perspective. And, working in a vertical world, meaning, buildings, elevators and the like, it's quite a bit different. If you look at, Texas or California, or places where people aren't as dense and have fewer cases. So I do think it's going to be a local phenomenon and managed locally. And let's face it, whatever we say from a government perspective, individual human beings are going to make their own choices about what they feel comfortable doing. If I listen to Jim Cramer, it sounds like he's going to keep a rubber suit on for a long time, where other people might say, well, gee, I feel comfortable going to a restaurant in my community or being with people that I know. I might be a little more trusting. But I think human psychology here is going to play a lot into, okay, we're open. What does that mean?
Yeah, I'll give Jim credit. At least he's in Inglewood Cliffs. He's been going into headquarters every day. I'm saying this from a bedroom in my house. Dave, let's just talk a little bit about potential shortages, because there has been so much discussed about the supply chain, the idea that so many of our pharmaceuticals, the base supplies come from China. There have been a lot of questions about that and a lot of concern as we were heading into this lockdown that people needed to get their pharmaceuticals, anything they absolutely needed to take in big supplies ahead of time. Have we seen any of those problems actually develop? Are there drugs that you can't get a hold of in your pharmacies?
Well, at this point, if you go back a month, we started talking about supply chain in early March with the obvious facts that some of these ingredients come from China and India. What we have in stock in the U.S. from the suppliers that we deal with in our own stocks make us comfortable that we can get through, let's say the next 3 to 6 months, without any real risks. But there will be spots where behavior, again, if you like chloroquine, there was a rush in buying, people trying to stock up, hoarding might be a word that was applied. And that's a drug, as you know, it gets used for lupus, it gets used for rheumatoid arthritis. So there are people who are on that need access to it. And if we end up creating a shortage because of hoarding, that's not good. At the moment, what our people say is that we are cautiously optimistic about our ability to manage the supply chain, all predicated on how long this lasts. I mean, how much longer we'll see it. And obviously, we're talking with all of our suppliers about making sure we have adequate access.
Dave, very quickly, you serve on the boards of AT&T, PayPal, and Yum. And I just wonder broadly, from all of the different sectors of business that you see and that you have a perspective on, how much do you think is going to come back and how quickly? How much has consumer behavior changed? And are there places, I would say maybe PayPal sees some upside because of online shopping. How quickly do you see people going back to casual restaurants and things like that?
Well, actually, I'm not on AT&T's board anymore since I retired as CEO. And Yum, I also left, but I'm on Dell's board today. So I can say from PayPal's perspective and Dell, in addition to CVS, obviously in PayPal's case, you're exactly right. They're seeing more activity, people shopping from home, increases in the number of net new actives, new PayPal customers that have come from this. So from them, but they also have large customers who have been affected. Airbnb, Uber, for example, their traffic is down and they use PayPal for payments. I think, a lagging indicator would be someone like Dell, who's in the infrastructure business. You see some increases in certain product areas, but, as time goes on, general business demand, could be affected. So I think from my perspective, it's just like we talk about reopening the country. It really depends. What's going on in the airline business is dramatically different than what we're seeing in other parts of the economy. If you're in travel, lodging, entertainment, those businesses have largely been shut down. And I think the question is, how quickly do those actually come back? Where I think businesses like CVS, to the extent we won't see the surge we've seen going on, but I think returning to something that looks more normal will be less of a change for us.
Great. Dave, thank you. It's good to see you. And we hope to talk to you again soon. Appreciate your time.